Have you ever wondered what really happens if a man over 60 masturbates too often? Today we're diving into a topic that few men feel comfortable discussing, yet it affects so many sexual habits in later life. As men age, their bodies undergo significant changes, muscles recover more slowly, hormone levels fluctuate, and tissues respond differently to stimulation. These shifts mean that what might have been harmless in younger years could carry unexpected consequences after 60. I'm Dr. Henry Carter, a board-certified urologist with over 30 years of experience treating men's health issues. I've seen firsthand how misconceptions about sexual activity can lead to unnecessary worry or conversely ignore real warning signs. In this video, you'll learn how frequent masturbation can impact prostate health, hormone balance, and overall well-being for older men. We'll examine what frequency truly counts as too much, highlight the physical and emotional warning flags to watch for, and share proven strategies to maintain a healthy sex life. Along the way, I'll introduce a simple approach to tracking your habits, explain dietary and exercise tips that support prostate comfort, and later discuss a natural supplement called Nitric Boost that many of my patients have found helpful. By the end, you'll have a clear understanding of how to enjoy intimacy safely and confidently, even as your body changes with age. So let's begin by exploring why the aging body reacts differently to repeated stimulation and what you need to know to stay in tune with your health. The aging body and sexual function. As we age, every system in the body undergoes change, and that includes the reproductive system. After 60, it's not unusual for testosterone levels to dip gradually. This shift can affect libido, energy levels, and the pace at which tissues recover after stimulation. Meanwhile, blood vessels may lose some of their elasticity, which makes it a bit harder for the body to sustain firm erections if circulation isn't optimized. Another key factor is that pelvic floor muscles and the prostate itself become more sensitive to repeated activity. In younger years, these muscles bounce back quickly, and the prostate can handle frequent ejaculation without much fuss. But past 60, the same intensity of stimulation day after day can leave the prostate gland feeling inflamed or irritated. That's why men who once enjoyed daily solo sessions might suddenly notice pelvic pressure or stiffness that lingers for days. At the same time, recovery time lengthens. Younger men can often bounce back within hours, but older men may need a day or two to return to baseline. When that recovery window isn't respected, tissues don't get the rest they need to repair micro snags in nerves and vessels. Over time, that can translate into decreased stamina, difficulty maintaining firmness, or even mild discomfort during erection or urination. It's also important to note that age-related changes aren't uniform genetics. Overall health and lifestyle choices all play a role. Two men at 60 can have vastly different sexual endurance based on diet, exercise habits, and medical history. What remains consistent, though, is this: the older body simply needs more time to recuperate. In the next section, we'll look at what counts as too often when it comes to masturbation after 60 and how to recognize when frequency begins to outpace the body's ability to recover. What counts as too often? When discussing frequency, it's easy to fall back on vague terms. So what does too often really mean for a man over 60? The truth is that there's no single number that fits everyone. In younger years, daily masturbation might be completely harmless. But once you cross into your 60s and beyond, factors like prostate sensitivity, hormone shifts, and slower tissue recovery all change the equation. A useful rule of thumb is to pay attention to how your body feels afterward. If you're unwinding daily and notice no discomfort, fatigue, or changes in urinary function, you're likely within a healthy range. However, if you find yourself engaging in solo sessions more than 3 or 4 times per week and you start to feel lingering soreness in your pelvic area, or notice your libido dipping, that could be a sign you've gone past your personal threshold. Individual factors matter too. For instance, a man who keeps up with regular cardiovascular exercise and maintains a balanced diet might handle slightly higher frequency without issue. On the other hand, someone with an enlarged prostate or borderline low testosterone may find that even twice a week feels like too much. It's less about matching a fixed number and more about observing patterns. If you begin to experience nagging fatigue, decreased performance during partner sex, or any urinary irritations, it's time to reassess. It also helps to track your routine over a few weeks. Keep a simple log note the days you engage in self-stimulation and jot down any symptoms afterward. Over time, you'll begin to see correlations between frequency and how quickly you recover. By tuning into these signals, you empower yourself to adjust naturally rather than relying on benchmarks that may not apply. In the next section, we'll explore how excessive activity can strain the prostate and lead to inflammation, outlining the specific red flags you want to watch for. Prostate stress and inflammation. The prostate is a small gland nestled just below the bladder, and its primary role is to produce fluid that nourishes and transports sperm. With each ejaculation, the prostate squeezes to expel that fluid. In younger years, it handles this task effortlessly, but after 60, the prostate's resilience can decline. Repetitive stimulation day after day can lead to microtrauma within the gland, causing inflammation, known as prostatitis. When the prostate becomes inflamed, you might notice a range of symptoms: a sense of fullness or heaviness in the pelvic region, a burning sensation during urination, or that urgent need to visit the bathroom more often. Some men describe a dull ache between the scrotum and rectum, which can persist for several days. If you've ever experienced that lingering discomfort after an episode of frequent self-stimulation, it's likely a sign that your prostate is crying out for a break. Inflammation occurs because those tiny blood vessels and tissues within the prostate lose their ability to bounce back quickly. Over time, the gland can become hypersensitive. A few extra sessions in a week might be no big deal, but when frequency outpaces recovery, fluid can build up, pressure increases, and the gland swells. This swelling can press on the urethra, the tube that carries urine, resulting in a weaker stream dribbling or difficulty emptying the bladder fully. It's important to recognize that not every twinge of discomfort indicates severe disease. Occasional irritation usually resolves with rest and hydration, but if swelling becomes chronic, it can set the stage for recurrent prostatitis and in rare cases contribute to complications such as urinary retention. Furthermore, an inflamed prostate can interfere with the delicate balance of nerve signals responsible for maintaining an erection. You might suddenly find it more difficult to achieve or sustain firmness, and the pleasure you once took for granted feels muted or even painful. Keeping an eye on any changes, especially urinary symptoms or persistent pelvic pain, can help you catch inflammation early. In many instances, simply dialing back frequency for a week or two, increasing water intake, and incorporating gentle pelvic floor stretching can ease the discomfort. If symptoms persist beyond a fortnight, seeking a professional evaluation ensures that any underlying issues like bacterial prostatitis aren't overlooked. In the next section, we'll examine how hormonal fluctuations play into these challenges and why testosterone levels are crucial when discussing frequency and recovery. Hormonal imbalances in testosterone. After 60, testosterone naturally declines, often by about 1% each year. This hormone is responsible for maintaining muscle mass, energy levels, and importantly, sexual drive. When men engage in frequent ejaculation, testosterone levels temporarily drop. In younger men, this dip recovers quickly, but for older men, the rebound may take longer. If you're ejaculating multiple times per week, those repeated dips can accumulate, leaving you feeling fatigued or less motivated. Low testosterone doesn't just mean a lower libido, it can also affect mood, leading to irritability or mild depression. When you pair that with slower tissue repair, you create a cycle in which you're both physically and mentally less eager to engage in intimacy. For example, imagine waking up one morning feeling unusually tired. You decide to masturbate later in the day to lift your spirits, only to find that afterward, you feel even more drained. That's a classic sign that hormone levels and recovery time aren't in sync. Additionally, testosterone plays a role in maintaining nitric oxide production, which is crucial for healthy erections. When testosterone dips, the signals that prompt blood vessels to relax and fill the penis can weaken, making it harder to achieve full firmness. If you're noticing that you're not as hard as you used to be, or that erections don't last as long, excessive masturbation may be part of the picture, especially if you're not allowing adequate recovery between sessions. It's also worth noting that low testosterone is linked to other health concerns: loss of muscle tone, reduced bone density, and slower metabolism. Over time, these changes can affect overall vitality. So when we talk about too often, we're not just considering temporary fatigue. We're looking at cumulative hormonal stress. A helpful practice is to monitor how you feel over several weeks, track your energy levels in the morning note, any mood swings, and compare days when you abstain versus days when you engage. If you see that frequent ejaculation correlates with lower energy or more mood fluctuations, it's a clear signal to scale back. In the next section, we'll focus on the specific warning signs, both physical and emotional, that indicate you may be pushing too far. By recognizing these warning flags early, you can make adjustments before more serious issues develop. Common warning signs to watch for. As you consider your sexual habits, it's vital to pay attention to signals your body sends. One of the first red flags is persistent pelvic discomfort. If you feel a dull ache between the scrotum and rectum that doesn't resolve within a day or two, it could indicate that your prostate or surrounding muscles need a break. Similarly, burning or stinging during urination can point to irritation or inflammation of the prostate gland. You might notice sudden urgency where you feel the need to urinate, even if your bladder isn't full, or a weak urinary stream that dribbles instead of flowing steadily. On the sexual side, watch for changes in erection quality. If achieving firmness becomes more difficult than usual, or if erections fade quickly despite stimulation, that can signal strained blood flow or hormonal dips. Sometimes men describe a sense of flatness that wasn't there before. Erections feel less rigid and penetration feels muted. If those changes persist beyond a week, it suggests the tissues haven't recuperated fully between episodes. Emotional and mental warning signs are equally important. After ejaculation, it's normal to feel brief relaxation or mild fatigue. But if you consistently wake up in the morning feeling drained, or if routine tasks seem harder because energy levels are low, those are signs of hormonal imbalance or overtaxed recovery. Mood fluctuations, irritability, sudden sadness, or lack of motivation often accompany low testosterone. If you notice that on days you engage frequently, you feel less inclined to socialize or exercise, that hints at deeper hormonal shifts. Another signal is sleep disruption. Restless nights, difficulty falling asleep, or waking up frequently can be tied to the same hormonal and circulatory stressors affecting sexual function. Keep in mind that if you experience 2 or more of these symptoms, persistent pelvic pain, urinary irritation, dull erections, chronic fatigue, or mood swings over a 2-week span, it's a clear indication that frequency has outpaced your body's ability to recover. Observing these warning signs early allows you to adjust before inflammation or hormonal strain leads to more serious issues. In our next section, we'll explore healthy sexual habits and moderation tips to help you stay in balance. Healthy sexual habits and moderation tips. Finding balance is key. Instead of pushing for daily sessions, aim for quality over quantity. Listen to your body if you notice soreness, fatigue, or a drop in performance. Give yourself a rest day. For many men over 60, limiting masturbation to 2 or 3 times per week, while still allowing flexibility based on how you feel, strikes the right balance between enjoyment and recovery. Pair self-stimulation with partner intimacy when possible. Engaging in partner sex or mutual foreplay not only adds variety but also shares the physical demands. Your partner's pleasure can become part of the equation. This helps prevent repetitive strain on your prostate and pelvic floor muscles. Incorporate simple pelvic floor strengthening exercises into your routine. For example, practice Kegel holds by contracting the same muscles you use to stop urine flow. Hold for 5 seconds, then relax for 5 seconds, repeating 10 times. Over weeks, build up to 3 sets per day. Stronger pelvic floor muscles support blood flow, improve erectile control, and reduce recovery time after ejaculation. Track your frequency and symptoms in a brief journal. Note each time you masturbate and immediately jot down how you feel afterward. Did you experience fatigue, pelvic tenderness, or mood dips? After 2 to 3 weeks, review patterns. If you consistently feel worse on days following higher frequency activity, adjust downward. This simple log empowers you to make data-driven choices rather than guessing what feels right. Finally, integrate rest days and alternative forms of intimacy. On days when you abstain from masturbation, consider gentle full-body stretching or a short walk to stimulate circulation without overtaxing tissues. Even activities like light yoga or a warm bath can promote muscle relaxation and help clear residual prostate inflammation. By blending moderation pelvic floor exercises and conscious tracking, you'll maintain a satisfying sex life without sacrificing comfort or long-term health. Lifestyle strategies to protect your prostate. As we look at long-term prostate health, lifestyle choices play a powerful role in preventing inflammation and preserving function. First, let's talk about diet. What you eat can directly influence inflammation levels throughout the body, including the prostate gland. Incorporating foods rich in antioxidants, such as berries, leafy greens, and colorful fruits, helps neutralize free radicals that can contribute to tissue irritation. At the same time, healthy fats like those found in avocados, nuts, and fatty fish supply omega-3s, which have anti-inflammatory properties. Conversely, highly processed foods, excessive red meat, and refined sugars tend to promote inflammation. By gradually replacing these items with whole grains, legumes, and lean protein sources, you create an internal environment that supports healthy glandular tissue. Tomatoes and watermelons specifically contain lycopene, which has been linked in several studies to lower rates of prostate enlargement and inflammation. A simple evening snack of tomato slices drizzled with olive oil or a small bowl of fresh berries can be a proactive step toward tissue resilience. Hydration is another cornerstone of prostate support. Drinking sufficient water thins urine and regularizes flow, preventing the urinary stasis that can irritate the prostate. Aim for at least 6 to 8 8-ounce glasses of water per day, spread evenly across waking hours. For men who exercise vigorously or live in warmer climates, additional fluid intake helps replace what's lost through sweat. Keeping urine more dilute reduces the risk of bacterial overgrowth, which can lead to prostatitis. Turning to physical activity, regular exercise, particularly moderate cardio, like brisk walking, cycling, or swimming, promotes circulation throughout the pelvis. Improved blood flow delivers oxygen and nutrients to prostate tissues, aiding in recovery after any irritation. Strength training, when performed correctly, also supports hormonal balance by encouraging lean muscle mass and stabilizing testosterone levels. As a rule, aim for at least 150 minutes of moderate aerobic activity each week, alongside 2 sessions of light resistance training focused on major muscle groups. Stress management is often overlooked, but critically important. Chronic stress triggers the release of cortisol, which can exacerbate inflammation and negatively affect hormone levels. Incorporating short breathing exercises or mindfulness breaks, even just 5 minutes at a time, can lower stress markers throughout the day. Gentle yoga or Tai Chi not only reduces tension, but also gently stretches pelvic floor muscles, further reducing strain on the prostate. Sleep patterns matter too. Quality sleep allows hormonal systems to reset testosterone production peaks overnight, and tissue repair occurs while you rest. Aim for 7 to 8 hours of uninterrupted sleep each night. If you struggle with sleep, consider a consistent bedtime routine, dimming lights an hour before bed, avoiding screens, and keeping the bedroom cool and quiet. Overall, combining a nutrient-rich diet, proper hydration, regular exercise, stress management, and restorative sleep creates a protective foundation for prostate health. By weaving these habits into your daily life, you reduce the likelihood of chronic inflammation, support tissue repair, and help maintain optimal function as you age. Nitric Boost. Now let's talk about Nitric Boost, a natural supplement designed to support healthy blood flow and ease pelvic tension. Nitric Boost combines L-arginine and beetroot extract, which work together to enhance nitric oxide production in your body. Nitric oxide helps relax blood vessels, allowing more oxygen and nutrients to reach prostate tissues and pelvic muscles. For many men over 60, improved circulation means faster recovery after sexual activity and more consistent firmness during intimacy. By promoting better blood flow, Nitric Boost can reduce that lingering sense of heaviness or ache in the pelvic area, helping you feel more comfortable and energized. It also supports erections with enhanced nitric oxide levels. The signals that allow blood to fill the penis become stronger, making it easier to achieve and maintain firmness. One of my patients, a 67-year-old gentleman, shared that after just a few weeks of taking Nitric Boost daily, he noticed less discomfort around his prostate and a noticeable uptick in stamina when with his partner. While it's not a cure-all, moderation, exercise, and diet remain key. Nitric Boost can be a valuable addition to your routine. If you decide to try it, take Nitric Boost with a glass of water after a light meal. Give it a few weeks to see how your body responds, And remember to continue the habits we've discussed so far: moderation, pelvic floor exercises, and smart lifestyle choices. Real-life testimonials. Let's look at real-world experiences. John, a 65-year-old retiree, noticed a dull ache in his pelvic region whenever he tried to masturbate more than twice a week. After dialing back to 2 sessions per week and starting Nitric Boost, he reported that the ache disappeared within 10 days. He found that combining the supplement with daily Kegel exercises gave him a noticeable boost in both comfort and performance. Then there's Robert, age 62, who struggled with fatigue and low mood after frequent solo sessions. When he began tracking his frequency in a simple journal, he realized he was overstimulating his prostate without giving it time to recover. After reducing to 3 sessions per week and adding Nitric Boost, Robert's morning energy levels improved and he felt more motivated to exercise. He also noted that his erections felt firmer and lasted longer during partner intimacy. These anecdotes echo what we see in clinical studies. A 2022 article published in the Journal of Urology highlighted the role of nitric oxide precursors such as L-arginine in improving blood flow to pelvic organs. Researchers found that men over 60 who supplemented with L-arginine experienced a 15–20% increase in peak urinary flow rates and reported less pelvic discomfort after ejaculation. Similarly, beetroot extract's contribution to nitric oxide has been correlated with reduced markers of inflammation in prostate tissue biopsies. Dr. Susan Miller, a urologist at the Center for Men's Health, explains that enhancing nitric oxide pathways can make a significant difference for older men who experience mild to moderate prostate irritation. When combined with behavioral changes like moderated frequency and pelvic floor strengthening, the benefits multiply. Taken together, these personal stories and expert findings underline that small adjustments paired with targeted supplementation can lead to substantial improvements. Notice how each individual's success hinged on recognizing warning signs, adopting healthier habits, and giving their bodies the support needed to heal. In our next section, we'll explore specific pelvic floor exercises that you can incorporate at home to bolster these benefits even further. Preventive exercises and pelvic floor techniques. Next, we'll cover simple yet effective exercises that strengthen your pelvic floor muscles, which in turn improve circulation and support recovery. First, let's focus on the classic Kegel. Imagine you're trying to stop the flow of urine midstream. That contracting sensation is exactly what we want to train. Tighten those muscles, hold for a count of 5, then relax fully for another count of 5. Repeat this cycle 10 times in a row and aim to do 3 sets throughout the day. Over a few weeks, you'll notice stronger muscle control and less lingering tension after ejaculation. Another valuable move is the bridge. Lie on your back with knees bent and feet flat on the floor, hip-width apart. Slowly lift your hips, engaging glutes and pelvic floor together until your body forms a straight line from shoulders to knees. Hold for 3 seconds, then lower gently. Perform 10 repetitions, 2 to 3 times per session. This exercise activates the entire core and presses gently on the pelvic muscles, encouraging better blood flow. Finally, let's try the seated pelvic tilt. Sit upright on a chair with feet flat and spine neutral. Take a deep breath, then as you exhale, tilt your pelvis forward, tuck your tailbone under, and contract the pelvic floor as if you're lifting it upward. Hold that contraction for 3 seconds, then release and return to a neutral spine. Repeat 10 times, once or twice daily. This motion strengthens the deep muscles that support your pelvic organs and helps reduce residual inflammation. Consistency is key. Commit to these exercises at least 4 or 5 days a week. As you build strength, you'll notice faster recovery after sexual activity, more reliable control during intimacy, and fewer instances of pelvic discomfort. Remember, these moves are gentle. If you encounter sharp pain or severe cramping, ease off and consult a healthcare professional. By combining Kegel's bridges and pelvic tilts, you create a balanced routine that supports prostate health, reduces inflammation, and improves erectile quality. In our final section, we'll wrap up with a quick review of everything we've discussed and offer some last words of encouragement. Conclusion. Today, we've explored how frequent masturbation after 60 can affect prostate health, hormone levels, and overall well-being. We discussed how the aging body recovers more slowly, why repetitive stimulation can lead to prostatitis, and how hormonal dips can leave you feeling fatigued or less motivated. You learn to recognize warning signs: persistent pelvic discomfort, urinary irritations, decreased erection quality, and mood shifts, so you can adjust before minor issues become major problems. We covered healthy habits like moderating frequency, incorporating partner intimacy, and strengthening pelvic floor muscles through Kegels bridges and pelvic tilts. You saw how lifestyle choices, anti-inflammatory foods, proper hydration, regular exercise, stress management, and quality sleep create a solid foundation for prostate resilience. And we introduced Nitric Boost, a supplement designed to enhance nitric oxide production, improve circulation, and support faster recovery after sexual activity. Real-life testimonials and expert insights showed how combining moderation exercise and targeted supplementation can lead to noticeable improvements in comfort and performance. By paying attention to your body's signals and making thoughtful adjustments, whether that means dialing back session frequency, journaling symptoms, or integrating daily pelvic floor exercises, you empower yourself to enjoy intimacy safely and confidently at any age. Remember, small changes add up over time. A balanced diet, consistent exercise, and occasional rest days can keep you feeling strong and vital well into your later years. If this information has been valuable, please hit the like button, subscribe for more expert tips, and share this video with anyone who might benefit. Your sexual health is a lifelong journey. Stay informed, listen to your body, and make choices that honor your well-being. Thanks for watching, and I'll see you in the next video.